don't know about you, but I am sick and tired of this mockery that we call a national health care debate in America. This is supposed to be a debate about the 45 million people without insurance, either because they've been discriminately denied coverage or they simply cannot afford it. We're supposed to be talking about the 200 million people with health care who are finding it more difficult to afford with each passing day. This is supposed to be about how to provide choice and competition in an industry crowded by a handful of monopolies. It should be about the fact that the exponential rise in healthcare costs is economically unsustainable. And even though we spend more than any other nation on healthcare, we're not any healthier for it. But if you've been watching the news lately, apparently that's not the story at all. And if you listen to the GOP, the story is about the government socializing medicine and deciding whether or not to euthanize grandma. It's about government-subsidized health care for illegal immigrants. We already pay for them, by the way, every time they require care in our public hospitals. And secret teenage abortions in public schools. It's about health care rationing and protecting the free market from evil government intrusion. Enter the Republican no-spin zone.
Congressman Wong, thank you so much for joining us. From what you've heard so far about some of the ideas coming from this new administration regarding health care, are you in support of it?
Well, it's probably the next major step towards socialism. I hate to sound so harsh.
Sarah Palin on her Facebook page yesterday said that the America I know and love is not one in which my parents or my baby with Down syndrome will have to stand in front of Obama's death panel so as bureaucrats can decide based on a subjective judgment of their level of productivity in society whether they are worthy of health care. Such a system is downright evil.
The reforms I'm proposing would not apply to those who are here illegally.
I believe in the truth. What I heard was not true.
And as a matter of fact, the bill goes on to say what's going to go on. Comprehensive primary health services, physicals, treatment of minor, acute, chronic medical conditions, referrals to follow-up for specialty care. Is that abortion? Does that mean that someone's 13-year-old daughter could walk into a sex clinic, have a pregnancy test done, be taken away to the local Planned Parenthood abortion clinic, have their abortion, be back and go home on the school bus that night? Mom and Dad are never the wiser.
The politicians and the bureaucrats and government deciding things is exactly what the purpose of the Comparative Effectiveness Research Council is. It's modeled after the NICE program in England that limits care for individuals based upon their age and other disease factors and cost.
We ought to be talking about government takeover of the healthcare system. And you remember, a government-run plan, when you got the government running something, the government's not a fair competitor. The government is a predator, not a competitor.
Did I hit my head and wake up in some alternate universe, or is this really the conversation that we're having about the state of our healthcare system? These claims are ludicrous. They are lies, and they are irrational. Healthcare reform is not about socialized medicine. Private health insurance companies will still exist. Doctors won't work for the government. Voluntary end-of-life counseling between you and your doctor does not constitute a government death panel. Illegal immigrants will still be barred from government-subsidized health care. Funding for school nurses does not include state-sanctioned abortions for public school students or anyone else. Comparative effectiveness research, the neutral studies that investigate the most effective way to treat disease, will not lead to rationed care. And an affordable, not-for-profit health insurance company administered by the government will not unnecessarily threaten a monopolized marketplace, even if the ghost of Reagan told you so. Democrats should have taken the time to refute these asinine conservative premises right from the start and offered their own. But centrist Democrats in the U.S. Senate, with a lack of early public leadership and direction from the White House, decided to accept these postulates and build a half measure from there.
When it comes to health care, we don't want socialized medicine, but there is an appropriate role for government to expand coverage, to make it more affordable for people who don't have the means.
One of my biggest concerns has been how to have a public option, if at all, and I haven't seen it structured in any way that I have found it acceptable up front as a competition in the marketplace.
What's the problem with the public health option?
Well, many of us believe, George, that it will undermine the private insurance system.
What I've questioned is a public option tied to Medicare levels of reimbursement, since my state has the second lowest Medicare reimbursement rate in the nation.
Finance Committee Chairman Max Baucus is working on his own compromise with Republicans. Of course, they killed the public option altogether in that committee. They have signed on to what is known as a co-op plan.
There's nothing about the structure of a co-op that would make it more efficient or would force the market to be more efficient. So I'm not sure what this idea that's coming out of the Senate Finance Committee, where the evidence is to support it.
Only $3 million to Chairman Baucus in exchange for a bill in which the health insurance industry is guaranteed to make billions upon billions? We know what you are, Senator Baucus. We're now arguing about the price.
Someone answer me this. Why are the Democrats so feckless every time they are in the majority? 60 votes in the Senate, 256 votes in the House of Representatives, a supermajority in Congress. The most popular president of a generation, and the Democrats can't even pass, hell, can't even sell comprehensive health care reform that will make everyone's lives better in tangible ways. I've got a message for the president and his buddies on the Hill. This is not 1993. You have a mandate from the people for swift, transformative, and progressive change. Do not kowtow to dishonest brokers in Congress and the lure from robber barons of the status quo. Now, we need to ban the practice of denying health care coverage to those who need it. And everyone needs health insurance that is comprehensive and preventive, because it will make them healthier and make the system more cost-effective. We need a robust public health program, not just for seniors and veterans and Congress, but for everyone who wants it. When the free market refuses to innovate and streamline, it is up to a responsible and active government to catalyze a competitive environment. If we do these things, we will accomplish not only the economic imperative of driving down the cost of healthcare over the long term, but also we will accomplish the moral imperative of making sure everyone has healthcare in America. Alas, Democrats who are afraid of their own shadow and Republicans who are afraid of the president have decided to obstruct what is necessary and long overdue reform for our country. The question is, will you allow them to stand in the way? Remember that all the politicians in Congress and the White House, they're public servants. They work for us. Our founders said that governments are instituted among men, deriving their powers from the consent of the governed. Do we consent to the will of a cacophonous and irrational minority? Do we consent to be governed by the least common denominator? Or are we looking for more out of our government? Do we expect more of America? Listen up, because here's what we gotta do. Most politicians live by the mantra, there go my people. I must find out where they are going so I can lead them. So let's lead them. Clearly, centrist Democrats have been hearing too much from Republicans and health industry lobbyists. Let's tip the scale. Let's bombard them with phone calls, emails, faxes, and in-person visits telling them exactly the kind of healthcare reform we want and need. These are the Democrats in the Senate that need to hear from us, the American people, right now. They work for us, so make sure they save some time for us. I guarantee you they had plenty of time for health industry lobbyists over the last year. I know from personal experience that it's easy to feel hopeless about the current state of events. It's easy to say, I'm just one person. What can I possibly do? But our democracy only works when we, the people, are actively engaging our government. These are the responsibilities that go hand in hand with our rights in a democracy. We need to fill their mailboxes and their phone sheets and their constituent meetings, because if we don't, the special interests and the naysayers will. It's 10 to midnight, and we need a major push to get the right kind of healthcare reform over these final hurdles in Congress.